Hello everyone, I'm Dr. Marut Gupta from KGMU Lucknow, and today I'll be teaching you about the arterial supply and the veins of the heart. The arterial supply consists of the coronary arteries, the right and the left coronary arteries, and the veins of the heart mainly restricts to the coronary sinus and few other veins. Before studying any topic, we must know why is this topic important for us. So first of all, in first year anatomy professionals, there can be a long answer question or a short answer question. The most important topic for that will be the coronary arteries or the arterial supply of the heart. Then it is an applied anatomy topic in various subjects. Example, in medicine, when we'll be studying about the myocardial infarction, there are different types of myocardial infarction based upon the vessel which gets blocked. And then it is an important topic for NEET PG examination as well. So first we will be studying about the arterial supply of the heart. The main vessel which supplies the heart is not the coronary arteries but the ascending aorta, which gives rise to the coronary arteries. And these are the right coronary artery and the left coronary artery. And these travel in the coronary sulcus. Sulcus kya hai? Sulcus is the depression in which the coronary artery goes. Then what are the features specific to the coronary arteries? First of all, the heart supplies itself during diastole. Matlab, the heart supplies the blood to the body during systole, but to itself it supplies during diastole. That is when the heart relaxes. Second thing is that the left coronary artery is always bigger than right coronary artery and supplies more area. Then these coronary arteries are functional end arteries. That means if one gets thrombosed, then the other artery cannot compensate. Then before writing any answer in our exam, we must always memorize the headings. So these are the headings under which we will write about an answer about the coronary arteries. First of all, the position of the coronary artery, its course, its branches, the area of distribution, the concept of cardiac dominance, and the clinical anatomy associated with it. The point of clinical anatomy is very important in any answer in anatomy exam. And the other thing that is very important is drawing a diagram. So this is the combined diagram which shows the right coronary artery and the left coronary artery and few of its branches on both the sternocostal surface, that is the anterior surface, and this is the posterior surface showing the diaphragmatic surface. So first we will be studying about the right coronary artery. So the first heading was position. So position mein there is origin, that is it originates from the anterior aortic sinus. Whereas the left coronary artery we will be studying that it originates from the posterior aortic sinus. Then the course we will be studying about in this diagram. So this is the ascending aorta, and from here arise from the left coronary artery and the right coronary artery. As we can see, the right coronary artery, it travels between the pulmonary trunk and the right auricle. This is the emergence. Then the first part of the right coronary artery travels down in the right coronary sulcus to the junction of the right and the inferior border. This is the junction. And from here it will wind backwards in the diaphragmatic surface. That is the inferior surface. It runs back and towards the left in the right posterior coronary sulcus to reach the crux of the heart. So this area is the crux of the heart. Then the termination. How does it terminate? It anastomoses with the left coronary artery at the crux. And which branch of the left coronary artery does it anastomose to? It is the circumflex branch of the left coronary artery that anastomoses with the right coronary artery at the crux. Then we will know about the branches. For the branches of right coronary artery, I will tell you a mnemonic, that is V camp. So first of all, from V is the ventricular branches. As we all know, the heart consists of the atriums and the ventricles. So first of all, the right coronary artery supplies the ventricle. So there are anterior and the posterior groups in the ventricle branches. Then there is the right conus artery from C. Then the right conus artery forms an annulus of Weissens. Annulus of Weissens बनाता है. So ये Weissens किसके साथ बनाता है? With the left coronary artery. And कहाँ पे बनाता है? It forms around the pulmonary trunk. Then the atrial branches. The atrial branches have three groups, the anterior, posterior and lateral. So ऐसे याद रखना है कि ventricle में दो groups थे and atrial में एक और आ जाता है, that is lateral group. And from this anterior group, there is also a SA nodal artery. So SA nodal artery in 65% of cases arises from right coronary artery, and in the rest it arises from the left coronary artery. Then fourth branch will be the marginal artery, and the fifth branch will be the posterior interventricular branch. So posterior interventricular branch supplies two areas. That is the septal, which is the posterior one-third area of the septal, and then the AV node branch. So essentially we can see here that both the conduction system, that is the SA nodal artery and the AV nodal artery, are both supplied from the right coronary artery and also the posterior one-third part of the interventricular septum. Then we come to the area of distribution of the right coronary artery. So first of all, right side की है तो right atrium and right ventricle दोनों को supply करेगी, and then some part of the left ventricle भी supply करेगी. ऐसे याद रखना है कि वेंट्रिकल तो बड़ा होता है, अब उसमें एक आर्टरी कैन नॉट सफाइस. एट्रियम में तो राइट एट्रियम पूरा हो गया एंड लेफ्ट एट्रियम हमारा हो जाएगा बाय लेफ्ट कोरोनरी आर्टरी, बट लेफ्ट वेंट्रिकल विल नीड सम मोर सप्लाई एंड दैट विल बी प्रोवाइडेड बाय द राइट कोरोनरी आर्टरी. Then we all know that the septal branch provided the posterior one-third of the IV septum, and all the conducting system is also supplied by the right coronary artery. So this was the right coronary artery essentially. Next, we will be studying about the left coronary artery. As I told you, the position or the origin is from the left posterior aortic sinus. Then the course. First of all, it emerges between the pulmonary trunk and the left auricle. Here is the left coronary artery. This is the emergence from the ascending aorta. And here only it gives the anterior interventricular branch, which travels downwards, and the rest continuing artery will be known as the circumflex artery. And this circumflex artery will be traveling in the left anterior coronary sulcus. Then as you can see, the circumflex artery winds at the left border of the heart and goes backwards. And in backwards, it travels in the left posterior coronary sulcus. Then the termination. We studied in the right coronary artery that the right coronary artery wound up and terminated by anastomosing with the left coronary artery. So the branch of the left coronary artery at anastomosis was the circumflex artery, and that branch is specifically known as the Kugel's branch, which is near the posterior interventricular group. Next, we'll be knowing about the branches of the left coronary artery. So the main two branches of the left coronary artery are the anterior interventricular branch and the other one is the circumflex branch. So the branches of anterior interventricular artery are CVS, that is the left coronary artery. The right coronary artery was from right coronary artery and the left coronary artery is here. Then the ventricular branches, the left ventricular branch can also be known as the left diagonal artery, LDA. And this is very important artery because during myocardial infarction, the LDA is the most common vessel to get blocked and it supplies a major portion of the heart. So if this gets blocked, then it leads to anterior wall MI. Then there is the septal branch, CVS. Then the circumflex artery gives rise to the atrial branches and the left marginal branches and also the ventricular branches. So atrial में वही anterior, posterior and lateral branch. Then the area of distribution. So the right coronary artery supplied the right atrium and right ventricle, and the left coronary artery supplies the left atrium and left ventricle. And as I told you, the right ventricle will be needing some part of the LCA as well. So small part of RV is also supplied by the LCA. Then posterior one-third was IV septum and exactly opposite, that is anterior two-third is from the LCA. Then whole of the conducting system was provided by the right coronary artery, but a part of the left branch of AV bundle. This is the only part of the conducting system that is supplied by the left coronary artery. So then the circulation in the heart, there can be two kinds of circulation. First of all is the myocardial circulation and the other is the collateral circulation. So myocardial circulation, that is within the heart. First of all, there can be two types of anastomosis. There is an interarterial anastomosis and there is an arteriovenous anastomosis. Interarterial, that is the LCA with the RCA. That was in the crux of the heart. Then arteriovenous anastomosis is mainly coronary artery giving rise to sinusoids, which then form the coronary sinus, which is the main vein of the heart. And the collateral circulation includes the cardiac and extracardiac. Then the concept of cardiac dominance. We all must know that who is the boss? The boss is that who gives the posterior interventricular branch. So we studied that the normally the RCA is the one which gives the posterior interventricular branch. So in 90% of cases, the RCA gives the posterior interventricular branch, and hence in 90% cases it is a right dominant heart. Whereas in 10% cases, the posterior interventricular branch is given by the LCA, and that is the left dominant heart. Then the heading of clinical anatomy. Personally, I think that this heading can fetch extra marks to an answer because it is actually the application of these basic subjects that is more important. So the main application is the subject of medicine in myocardial infarction. So in myocardial infarction, if a vessel gets thrombosed, then there can be myocardial ischemia and its infarction leading to its various types depending upon the blood vessel which gets blocked. Then angina. There are three kinds of angina: stable angina, unstable angina, and Prinzmetal angina. This depends upon the level of blockage which occurs in the coronary arteries. Then there is an investigation known as the coronary angiography, which can tell us about the different number of coronary arteries blocked, the site of coronary artery blockages, etc. Then for removing the thrombus, we undergo a procedure like angioplasty. And if we cannot control the symptoms with the help of angioplasty, then we will need to perform the coronary artery bypass grafting. So this was all about the arterial circulation of the heart. Now we will be studying about the veins of the heart. So the veins of the heart, the most important vein of the heart is the coronary sinus. It is the largest vein. It is in the posterior left coronary sulcus and it opens into the right atrium. As we know, the SVC and the IVC also open into the right atrium, and also the coronary sinus, that is blood from the heart, also drains into the right atrium. Then there are the tributaries of the coronary sinus. There are total 6 tributaries of the coronary sinus: the great cardiac vein, the middle cardiac vein, the small cardiac vein, the posterior vein of the left ventricle, and the oblique vein of the left atrium of Marshall, and the right marginal vein. So the veins can be identified as they travel along with the arteries. So the left marginal vein drains into the great cardiac vein, and the great cardiac vein travels with the anterior interventricular artery and the circumflex artery. Then the middle cardiac vein travels with the posterior interventricular artery. The small cardiac vein travels with the right coronary artery. Then there's the posterior vein of the left ventricle, oblique vein of the left atrium of Marshall, and the right marginal vein. So the right marginal vein can either drain into the small cardiac vein, or it can also drain directly into the right atrium. So this was the first vein, that is coronary sinus. Then we can see the anterior cardiac veins, which are 3 to 4 in number, and they run parallel, and they run at the anterior wall of the right ventricle. Then there is a vein known as the vena cordis minimi. It is also known as the Thebesian or the smallest cardiac veins, and these open directly into the cavity. So about these two veins, these open directly into the right atrium, whereas the other veins travel to the coronary sinus and then drain into the right atrium. So this is the diagram of the heart showing its different veins. As we can see on the diaphragmatic surface, this is the coronary sinus, which is the largest vein. And we can see its various tributaries, that is the small cardiac vein, the middle cardiac vein, the posterior vein of the left ventricle. Then we can see the left marginal vein, the great cardiac vein, and a little about the lymphatics of the heart. There are 2 trunks of the coronary arteries and hence 2 trunks of the lymphatics. The right trunk travels with the right coronary artery and drains into the brachiocephalic nodes, and the left trunk drains into the tracheobronchial at the trachea bifurcation.